Hello friends, in this video I'm going to go over shock and how you should recognize it, what you can do in the future if you encounter it in the field. So what really is shock? It's really just defined as hypoperfusion. And what that means is that there is not enough blood going around for the tissues. And if there's not enough blood, then you have less oxygen. And if that happens, then you can have organ failure. And that can lead to death. And if you missed it, this one is untreatable. So what are the types of shock that are out there? Well, the first one is going to be hypovolemic shock. Hypovolemic. And what this really means is that there is, loss of fluid, not enough blood going around. So this it can come from bleeding, massive blood loss from bleeding, or there's just low fluid from dehydration. And what are the key signs of it? Well, there's tachycardia, so a high heart rate, usually like above 100 beats per minute. And then there is cool, clammy skin. So that just means that the skin is pale, it's flushed, it's wet, and it's cold. And also a weak pulse. Now, what can you do to fix this? Well, if there is bleeding, you can control the bleeding via tourniquets or just gauze pads. And high flow oxygen, always. This can be a lifesaver. And keep warm. And rapid transport. So you'll find out that these four things are probably pretty much the only things you can do for most kinds of shock. It's going to be the most common treatment. Now, the second type of shock is going to be cardiogenic. Now, what does this mean? Well, this usually comes from heart failure. So the heart is weakened or fails to the point where it cannot pump enough blood to go around. Now, what are some key signs of this? Well, it can be chest pain, JVD, which is jugular vein distension. You can also have pulmonary edema and possibly dyspnea. So that's like a lack of breathing patterns. Now, what are the treatments for this? Well, again, it's going to be controlling bleeding if there are any, but usually there won't be. High flow oxygen. Now, this is going to include a non-rebreather and up to 15 liters per minute. And keep warm and transport. Warm and rapid transport. I'm just going to say RT. Now, the next type of shock is going to be distributive. And what this means is that it affects pretty much the entire body. And there are three types of distributive. One is septic, and that's just from an infection. Second one is going to be anaphylactic, so an allergic reaction. And the third one is going to be neurogenic. And then we'll get into what they all mean. So starting with septic, this just means that there's some kind of an infection in the blood vessels, or there's an infection that's going around. It will often cause vasodilation, and it's going to be accompanied by warm skin, a fever, so high temperature, high internal temperature, and tachycardia. And in late stages, you're gonna have hypotension, so low blood pressure. Now, what can you do to keep? What treatments can you do? Well, high flow oxygen, keep warm, and transport. It's pretty much the best you can do as a basic. Now, then we're going to get into anaphylactic. Now, this is from an allergic reaction. So if somebody got stung by a bee or they ate a peanut that they know that they're allergic to. So what can you do for treatment? Well, starting with symptoms actually. So we're gonna have airway swelling, wheezing, which is a breath sound that's often associated with anaphylactic allergic reaction, hypotension, and then hives are on the skin. So the treatment for this is obviously, so our usual treatments are going to be O2 and rapid transport. And there's an extra one actually. There's going to be admission epinephrine. And if you remember what the proper dosage is, it's going to be 0.3 milligrams for adult and 0.15 milligrams for children. Okay, and then the third type of distributive shock is going to be neurogenic. Now this often comes from spinal injuries, usually around the neck, spinal or neck trauma. And what happens is that the brain to heart connection is cut off due to the injury or the trauma. So this is going to be accompanied by bradycardia, plus hypotension. So again, hypotension means low blood pressure, and bradycardia, well, brady means slow, and cardia means heart rate, so a slow heart rate. So low heart rate. And what are the treatments that you can do? So obviously, again, it's going to be O2, keep warm, and transport. Now there are some extra things that you might be able to do. That's called spinal restriction. So, well, obviously they had a trauma to the spine and neck area, so you don't want to make it worse. And then the last type of shock that we have is going to be obstructive shock. It's a little less common, but it's still useful to know about it. Now, obstructive shock is, well, obviously the sound, from the name, it's going to be blocking of the blood flow. Now, whether it's a clot or just cardiac tamponade, there's something that's going on that is blocking blood flow. So what are some signs that come with this? Well, the symptoms are going to be usually severe dyspnea, so like lack of proper breathing pattern, jugular vein distension, and obviously hypotension. And guess what the proper treatments are? As always, going to be oxygen, or maybe even assisted ventilation. So this is where you use a BVM instead of a NRB. A BVM. And rapid transport. And one more thing that is pretty common in all of these is you might have to call for ALS backup if you don't have it. But yeah, that's pretty much all the shock types there are, and the symptoms that come with them, and the primary treatments. So yeah, hope that helps.